Okay, great. Thank you. So first I'll just say you guys are probably the only three that will read my 251-page dissertation. So thank you for taking the time to do that. So basically you guys kind of already have an idea of what my study was about. And so I'll just kind of provide just a capstone of my research and then the significance and what it meant for me. And so basically, I started this research project in 2013, and from then until now, it has just evolved in a variety of ways. I picked my population to be with women veterans for a variety of reasons, and I wanted to look at women veterans who were participating in equine-facilitated psychotherapy treatment. Because of time and resources and a lot of other variables, I ended up choosing to do qualitative research and have the women veteran experiences of EFP be retroactive instead of doing like a live study. And so that just seems kind of be the best course of action. So I chose to do qualitative methods for that to examine EFP treatment, helping women veterans who had been diagnosed with what I'm calling military-related PTSD, and I had done it for the past 3 years. So I kind of try to keep the time frame of when that retroactive treatment had been somewhat short, and I only wanted to include women that had participated in the military from 1990 to present because a variety of factors, but mostly because that's when you see a lot of women serving a lot more in the 1990s till now. And there's just been a lot more talk about PTSD and what's related to PTSD for women and for men, but more for women, is military sexual trauma, also known as MST. And so it's just grown over the years. And so I wanted to be able to narrow that down specifically. And I didn't want to, I mean, there's other mental health diagnoses that these women may have had, like they could have had depression, they could have had generalized anxiety disorder, they could have had traumatic brain injuries. I mean, they could have had a variety of things, but I try to just narrow it down to PTSD, just to try to be a little more succinct. And I wanted to see that. Right, so there's that, their treatment for PTSD with horses. But I was so curious about what it is about that horse-human connection and that connection that Dr. Hartelius was talking about how horses just have this like autonomic connection and response with us. And so I called that interconnectivity of the horse-human bond. And I was kind of highlighting that as the facilitation of the treatment process. So basically, my research question was what is the lived experience of EFP for women veterans with military-related PTSD? And lived experience, as you guys may know in the qualitative world, just means like a deeper experience, a subjective experience of a participant. And so I ended up actually being a perfect method and question for what I was looking for, because I really wanted to hear the voices of women veterans and what their experiences were like. And in turn, they were considered the experts, of their experiences and what they said and what they shared. And so after about 6 months of recruiting, I was able to have 10 women that volunteered to be part of my research study. Fortunately, because it was national, I was able to get women from different parts of the United States. But because my participants were so specific and like so precise, it was really hard actually to get participants because they had to meet my certain criteria, 1990s to present, diagnosed with PTSD, verified by a clinician or doctor, had to participate in EFP, had to be EFP past 3 years. So it was just really, really specific. So that was definitely a challenge in the recruitment time. But I was able to get 10 women, and I elected to do semi-structured interviews, and 7 of them were done over the phone, and 3 were done in person. And then those were all captured, and then they were transcribed, and then I was able to do the data analysis and then so forth. So the results were pretty cool. I mean, the results, I think, in a way, as the researcher and my background experience, you know, some of it I wasn't surprised that it came out, and I was just, if anything, I was just very pleased to see that the results that came through were being shown and demonstrated in past EFP research that I found, and so that was nice to see that that congruency there. There were some things that I thought were interesting, and I did not expect to come through with the results. And so, basically, speaking about the results, out of the 10 interviews and the thematic content analysis, I found 33 themes. Because I'm laughing at myself because Dr. Hartelius probably knows this, but I tend to have two things I say about myself. One is I'm a historian, and two, I'm thorough. And so I wanted to make sure I'm capturing everything. And so narrowing things down and being precise and concise is very difficult. But I was able to narrow it down as much as I could to 33 themes. And then I grouped them into 6 categories, into 6 categories. So of that, the 33, I pulled that had 5 or more participants that had more of the common occurrence were 11 themes. So 11 themes, and from that, some of it was expected, like I said, and then some of it wasn't. And so they were emotional discomfort with the horse, which I was not expecting to come through as something that almost all of them experienced. And I think this is interesting because a lot of the research I had looked at before, and that could be research that I looked at that could have been in dissertations, other articles, just the stuff that was available, is that none of them really talked about this, about how someone who's never been around a horse before might be terrified when they approach them. And so that was really helpful to know. And as a clinician, that's important for me to know that, you know, I take it for granted that I can just walk up to a horse and pet them, but someone might be scared. So that was interesting to find. And that also that it didn't prevent any of the women from continuing to participate in their treatment. So that was pretty cool. That even though they were scared and they have PTSD, which post-traumatic stress disorder is, which you guys may know, but it's categorized in the DSM as a trauma or stressor-related disorder, and happens when someone has experienced a significant traumatic event. And it can be a one-time event, or it can be multiple mini events, which can bring into what we call complex PTSD. And so it tends to really sit in someone's fight-flight responses in the amygdala and the limbic system and all of that. And so it tends to make the individual very, very tense, hypervigilant, a lot more reactive. You know, this is a very complex disorder and very, very difficult to treat. So I thought that was pretty profound, that the women, even though they were scared and literally would say, quoted, you know, I was absolutely terrified, that they still continued. So I thought that was really cool. And then the other things that I found were this kind of confirmation in a way. And I just thought it was lovely that it was captured. And the next one was spiritual experience with the horse. I experienced the safety with the horse, visual contact with the horse, emotional connection. And then, of course, the outcome of it was awesome to find, with the beneficial impact of therapy, increased connection with others, reduced anxiety, reduced withdrawal. And then the other parts that I thought were pretty interesting was that all of them, or majority of them, had said that after they participated in their EFP treatment, they wanted other people to participate in it. And they literally would go back to the VA group, support group that they may have been in, or someone in their veteran community, and advocate and say, you got to go do this, go try this, this is amazing. So I thought that was really neat because a lot of times people are pretty biased when it comes to, or not biased, but there's a big stigma with mental health, and a lot of people are ashamed to say that they've received help. And I very rarely have heard in outpatient therapy a client raving about a group and saying, hey, you got to go try this anxiety group over here or anything. So that was pretty neat to see that quite a few of them loved their experience so much that they were willing to share it with others. And so that was EAP advocacy. And then the delayed awareness of PTSD, I was not surprised, but what was powerful with that was how long the women, after they had their incident that developed in PTSD, how long it took them to get treatment post-military. And some were 20 years after the incident had happened, or 15 years after the incident happened, that they finally, it just became too much in their world, and so they had to seek treatment. So it's not uncommon, especially because 9 out of 10 of my participants had military sexual trauma. 9 out of 10 was because of sexual assault, and 9 out of 10 was also because of sexual harassment constantly when they were in the military. And so it's not uncommon for a victim of sexual assault after it's happened that they don't get help. There's just so much shame and fear that comes up with it. And then there's also barriers to access and to reporting what happened to them. And so the delay can happen for a while. And it was interesting to see quite a few participants had mentioned that, and that women just stuff things, women just hide things, and women just move on. And so that was hard to see. So there was a part of me that became a little more of a political activist, so to speak. And so I really wanted to include a whole section of the results that had to do with what their experiences had been like in the military, and how they had experienced barriers to treatment, sexism, hostility, men's world kind of thing. So I just thought that was powerful and important to put in there. So what does that all mean? The significance of the results, I think, are that it did corroborate and did align with previous research. So that was nice to see that. And then I think that the significance of the findings were that the majority of women had developed what I called military-related PTSD because they did not have PTSD before they entered the service, but they got it because of the incident that happened to them, and then it developed in PTSD, and they still to this day have PTSD. So it just, I think that is significant to know from a treatment standpoint, and then just from a human being standpoint, how powerful these types of traumas can affect someone. I think in terms of the horse part and bringing the horse in was such a unique variable. And I think significant findings for that are that horses have, once I guess you get past the fear, they have this ability to be non-threatening. Horses that are safe can just kind of stand there, and they're kind of like a dog in some way. And I think they have just another way for someone to be able to project, to find safety, to find connection. And I feel that through interconnectivity with self and other is how we heal, and how we're able to move forward with things that have happened in the past. And so it was really fascinating to find that that for women, making sure on time, okay, and that for the sorry, I just lost my train of thought, but for yeah, so anyway, so just for the significant findings, I think that there was a lot that was shared about the individual lived experience of what it was like as a woman who had been traumatized in her past to find some kind of relief, whether it was short-term or long-term with horses. I thought was very profound, and to hear that from them, and that even after, even though it was post, 3 years prior or less than within that 3-year time period, that some of them still had relief from it at the time of interview. And most of them could remember and experience the release that they felt. And relief from suffering can be reduced anxiety, improved mood, less withdrawal, less isolating from others, opening up more. So I think all of that was pretty important to find. And then because I'm transpersonally biased and I consider myself to be a transpersonal psychotherapist and researcher, I think it was really beautiful that the spirituality part came through with the participant stories and how they felt like instant connection, how they felt the horse instantly connected with their spirit, with their heart. You know, all of that was just very lovely to find, in my opinion. And I think it just helps in a way validate how important it is for researchers to consider that element in research. Psychology world tends to be very mind-body dominant, as we know, and doesn't want to bring in spirituality. But it's so important to include that element and to have that as like more of a holistic way to treat someone. So I think that coming through was helpful and significant. And then what it meant to me was this was one of the most hardest things I probably will ever do, hopefully, in my life. This research has meant so much to me on a personal and professional level. I thought I was going to finish my dissertation in 3 years, but life has a way of throwing massive curveballs and changing things. And I experienced quite a lot of, unexpected events that happened with grief and loss and health, and just a lot happened in the past 6 years and definitely the past 3 years. And so it was interesting that around the time that I was doing the data analysis, that I was having a parallel countertransference of my own trauma in my past. So that was really powerful to have to work through. And I think because I come from the transpersonal world, which has like a lovely, in my opinion, way of really bringing in the researcher as part of the research in a way where it's organic and so it's kind of like very often in qualitative research, the researcher's voice comes through, you know, in the results or in part of why this mattered, where you wouldn't find that really so much in quantitative research or mixed methods. There tends to be a lot more a barrier to that, or just a shield between the researcher and the research. And that's fine. I mean, it just has to do with whatever the purpose of the research is in the first place. So that was interesting to work through. And then the quest that kept me going was that I really wanted to be able to be and help share the voices of these women and help in an advocacy way. And so I really tried to be accurate and do the damn best I could with this and try to get it done. And so it's meant a lot to me in my life, as I shared, and it's definitely changed me in ways that I never thought that it would. And it's definitely made me, I mean, there's so many times, honestly, that I wanted to give up and just say, fuck it, I'm done. Had to redo my data analysis twice, had to redo my results chapter entirely. So there's definitely some setbacks that were hard on my ego and were hard on my own desire of progressive timelines. But what kept me going were these women and my participants, and that I could not give up on them. And so there was that kind of individual motivation to get it done. And then, of course, my professional ego to say I'm a doctor. Of course, right? So I'm paying all these dollars for to be a doctor. So yeah, I mean, there's more I can say, but I just kind of wanted to, hopefully I'm summarizing everything okay, but if anyone has any questions or clarifications, I'm happy to take questions.
Actually, let me just, I won't be asking my questions right off the bat, but I wanted to give you some more opportunity because you finished in about 20 minutes. So we're still good on your timing here.
Okay.
I don't really know much about EFP. And we have 6 or 7 participants besides ourselves in this committee. So I was wondering if you could maybe just talk a little bit about what is EFP, what it's a typical session like, and
Mm-hmm.
also if you could, address the fact that this is an animal who doesn't speak. So there's something about this that's very different than other types of psychotherapy. If you can just, in a few minutes, just bring us a little bit to that sort of a more felt sense of this experience that the women have.
Yes. So equine-facilitated psychotherapy is also known as equine-assisted psychotherapy. It just depends which profession or horse person you say you are. But is a form of animal-assisted therapy which utilizes the human-animal bond as a catalyst for treatment. And animal-assisted therapy could pretty much be most animals. Could be, usually it's horses, dogs, cats, can be birds or rabbits. I guess snakes, but usually it's another organic thing. I guess fish too. Dr. Beck will say fish. And the horses are used as like kind of like an agent with that connection. And the human-animal bond is generally understood as like an emotional connection. It's like an emotional resonance that an individual or client will have with the other, which would say I or other in Taoism. But the other in animal-assisted therapy can be any animal. And so in equine psychotherapy, it's the horse. And equines can be anything. It can be, and there's meaning that it could be even be a mule, a donkey, an ass, or a horse. So it can be any variety of equines that are used. I tend to use more of the word horse, but I have worked with donkeys and mules in the past as part of the used in EFP treatment. So don't want to leave those little guys out either. And so basically, EFP is set up outdoors because the horses live outside. And it's treated generally just like a normal psychotherapy session. And so, so say, for example, it's the client's first time coming out there, they're going to get some kind of an orientation and some kind of rapport building. And so most clients have to be introduced to it and to understand what they're even doing. And then there's also the safety element of it. And so basically all clients would come that would have some kind of diagnosable mental health issue, could even be an adjustment disorder where they just have stress in their life and they need support. It doesn't necessarily have to be a hardcore diagnosis, but they come with some problem. And they're coming to seek relief from that. And so that relief is where you develop their treatment plan and how you're going to help them with that based on what they're coming in for. There's anxiety, depression, trauma. And so the horse is included in that. And horses are really cool in speeding up what we call the rapport process in psychotherapy, where they really, usually by the second or third session in EFP work, clients tend to demonstrate being a lot more relaxed and comfortable, more open with the therapist and stuff, whereas in traditional office-based therapy, it can take up to 5 to 6 sessions for someone to maybe feel more comfortable talking about their deepest, darkest secrets. So there's something about horses that kind of decreases that vulnerability and rapport building. And so so there's so many different ways you can use horses in the treatment process in EFP. And there's different professional organizations that have certain models and then have certain steps or experiential activities that you can do with the client and the horse. And so 2 big organizations that are the most common are PATH International, which stands for the Professional Association of Therapeutic Horsemanship. And with them, I am a credentialed therapeutic riding instructor for TRI and an equine specialist in mental health and learning. And those are just certifications that allow me to be able to do EFP under that kind of a protection, I guess, or qualification. I wanted to do the TRI part, which is the therapeutic riding instructor, because I have done both mounted and unmounted sessions, and I think there's benefit to both. And so PATH International will say, you know, they pretty much endorse the idea of EFP, and they'll say, great, horses are sentient beings. they're awesome. They have all of these well-being effects to them, but we're not going to tell you how you do it. As long as you're credentialed and licensed, you create your own treatment plans, essentially. So that's PATH International. The other one is EGALA. And EGALA is the Equine-Assisted Growth and Learning Association. And they're the most specific about what credentialed professionals can do. And they also endorse the horse as being sentient beings that, you know, are great for the facilitation process. However, in their EGALA model, they have absolutely no writing. And it's all unmounted work. And they have very specific step-by-step methods that the mental health professionals are supposed to follow. And they have very specific roles that what they call equine specialists, and then the riding instructor, or not riding instructor, but mental health professional would do. So they're a little more specific. So yeah, so just kind of going into that. But basically, say for example, the most common thing that I would do if a client comes out for the first time is I would introduce them to their horse that they're going to work with, and then start teaching them how to groom a horse. And just through that activity of learning something and getting to know the horse and everything tends to be a nice way to start it. So that might be the first couple of sessions that you're doing. And then it might turn into learning how to halter the horse, learning how to lead the horse. So you could integrate horsemanship skills in addition to it being a session. So it could just kind of be practical, you know, non-invasive, and then usually you just talk. Then there's also things where you can actually set up like an experiential activity. And like say, for example, there could be either, one of the most common ones is if you have like a group of horses out in a pasture, and you call what's observing the herd, you know, you come over there and then just watch and look at the horses and then ask the clients what comes up for them or what do they think of, or do the horses represent anything to them in their lives. So it's a little more object relational, gestalt kind of work there. And then for some of the kids, you might do more like fun, playful games, but basically you just do whatever activity with the horse makes sense for whatever they're coming in for. So, yeah, I mean, there's like games that you can do, there's equine activities you can do. So, yeah, so basically, yeah. Do you have any other, does that make any sense?
Let's
Maybe too much.
Yeah, I'm sure there will be plenty of questions. I already see one of the audience members is asking a question, but let's go through the committee first, and then we'll see how many of the questions that people are asking we can address. So Dr. Beck, please go ahead if you have any questions or comments.
Sure, nice to start, but just we should try to, Rebecca, as you know, whatever little therapeutic horseback riding research I did was with physical disability, which is actually more common than using horses for psychological issues. And we should just sort of remember that that too has a role. And maybe I don't know if you have ever done any of the kind of physical or occupational therapy that's been done with horses. But, you have done it. Okay, that's fine.
Yes. Yes, so I was a therapeutic, I've done both. So before I became a therapeutic riding instructor, when I worked at Dream Power Horsemanship, we worked with a lot of children that had physical disabilities. It could be anywhere from autism to cerebral palsy, or, you know, they would come out from like special ed classes, and then they would come and they would either, you know, learn how to lead the horse or just kind of be around the horses. If they ever did any riding, I would have to be a sidewalker, and so I learned how to like properly hold someone's leg for safety, how to help someone safely dismount who had a disability, how to help someone from a wheelchair get on the horse. So I did do a lot of that work from a physical disability standpoint, but I tend to gravitate a little more towards the mental health, and so that tends to be a lot more where I've discovered to be my passion. So.
No, that was fine.
Mhm.
I have I don't know if it's a question or just, I suppose I didn't appreciate that the PTSD population you're working with is probably much more because of sexual trauma than combat trauma, right? And is it, that itself is an interesting area. Is it, and is it because that women are not put into combat situations, or just because in the military, men are a bunch of shits?
Yeah, so that's a great question. I mean, women weren't, in quotes, allowed to serve in combat until very recently. But women had always been on the battlefield, you know, already, like as nurses or as some tech person, or so women would still get injured and be part of combat overseas, regardless, even though they weren't defined as combat ready or allowed to do that. Now they can. Women can serve or should be serving just equally as much as men and when they're deployed. But yeah, that's what really, so what drew me to work with women with MST was that I'll never forget, I was sitting at Dream Power doing an introductory group with women veterans. And it was a women's trauma recovery group, essentially, but we just call it the women's vet group. And they came out, and there's maybe like 6 of them. And we were all sitting in a circle just doing, you know, meet and greet stuff. And these 6 women were from different branches of the military, had served in different times, and all 6 of them talked about having an MST incident or more. And I was so struck by that I was like, that's what I'm doing. Because I knew I wanted to do horses and women. I just didn't know what about women. And then I narrowed it down to that. And that has just been wow. And so in my literature review, I have a lot of statistics that I put in there, and just a lot of information that demonstrates that 1 in 4 women in the military has MST. Most of that MST is sexual assault, but it can also be determined as, you know, sexual harassment, touching, groping, words, and that kind of stuff. So it's not always as a sexually assault. And then what's awful is that it can be repeated offenses. So it may not just be one time, but women could have it multiple times. And it's women, so PTSD is the 3rd most common mental health diagnosis from veterans. And for women, all of them are more likely to have PTSD as predominant for women veterans. And I think like 60% of them are more likely to develop PTSD from that, which is why I call it military-related PTSD. Yeah, it's very profound, and it's pretty rampant. And the military is trying to intervene with it, but if you read the part of my results where I talk about or share what the women shared about when it did happen to them and how nothing was done because of this higher order chain of command crap. When they did try to do something, then nothing was, they couldn't, like, especially if the assault had happened from an officer, that there was nothing that, in quotes, they could really do. And then, of course, there's the evidence of what happened, or, you know, then they have to tell their story again. So there was a lot of barriers to having any kind of repercussions from that. And so I kind of put in my suggestions that women do need to be taken seriously when this happens, and that not only should women, if they do report it, receive treatment as soon as possible, because we know statistically if someone has been sexually assaulted or they have experienced some PTSD incident, like a car accident, that the soonest they get into crisis intervention and the soonest they get into therapy, the less severe their PTSD will develop. They may always have, you know, residual PTSD features, but it won't stay as like severe for as long if they get treated right away. So I was advocating to have women have at least all paid, you know, therapy for 6 months right after, and even for a perpetrator. So if they did find out who it was, that person also received treatment. But it's difficult because the military is a very, you know, machismo, masculine, you know, they're trained to kill. And I think there's a certain amount of desensitization that's happened during military training that kind of makes them, in a way, lack empathy and treat people differently because they have to be able to kill anyone. if they're ordered to. So, so I think that can probably tie into that, in addition to the men's world and just the lack of women that are there. And then there's still a lot of men in the military who can be traditional and that they don't believe women should be in the military, or they don't believe that women should be granted to be in certain positions in the military. And I know that there are different training standards that are for women compared to men. And so there can be frustrations with that women are not asked to do as like competitive, well, not competitive, but like more, you know, they do like the boot camp and the trainings and stuff, that men have a certain quota or whatever they have to do to meet, and women are a little less, just because of the capability of the women's bodies. But men could still think that that's different, right? Because then they still think that's fair. So yeah, there's so many things that tie into it.
Okay.
Yeah.
Well, I think
Yeah.
let other people share as well. We can go back.
And then Kobe had a question from chat, and he asked, are you still there, Kobe? I don't know if he's still there, but he wrote,
Yeah,
yes, he's still there. Okay, he said, here's my question. Did you address your countertransference in your research? And if so, how did you work through it? Yes, I did. I had my own personal psychotherapy and about that, and then my own spiritual paradigm and my own understanding of trauma and how that works, and how I was able to help have recovery from that. And then when I did specify that, when I talk about that in the discussion part, is that if it did come up, I would step away and I would back off from it. I wouldn't come back to it until I had grounded myself. And these were things that came up that I had no idea would come up at all. Like, I did not even realize it, because it was right after that time that I had come out of a really bad situation. And so when I started the process, I didn't have PTSD. So it's just really unique how the universe does that and just aligns it in a way that I understood, I guess, on a deeper level, but that I still had to take really good care of myself and make sure that my bias wasn't put into their words or the results and stuff. Yeah. Okay, got it.
Rebecca, thank you, but we need to wait until the whole committee is done with their questions and feedback before we move on to the audience. But thanks for answering that question for now. And then we can actually have them speak. You know, they don't need to be silent throughout. So we'll just wait to go through the committee. I'm sure Dr. Beck has probably more questions to ask you first, but if not, we'll move on to Glenn. So Alan, did you want to ask any more questions?
I have lots, but one, at least something I think it's something to think about, especially since you're looking at horses from as its involvement in psychological issues. As you know, much of the literature, though, is using dogs. Can you start thinking about, if you were writing a major book on this area, where the horse and the dog, each one, where would be better to use, and how?
That's a good question. I think both in equal merit have the ability to help with the human-animal bond, to help someone transform and heal and change. I think that's very possible for both the dog and the horse to have that. I think that what makes the horse unique is that they are still so connected to their natural instincts and their fight-flight responses, that they're so hypersensitive and hyper-aware to their environments, that they reflect that, or what we call mirroring that, with humans. And so they instinctively have to pick up on us because we're considered predators to them. with the two eyes and walking. So very often there's that dynamic that we're considered the predator and they're the prey, and that they can smell us, they can tell if we're anxious or not, they can tell if you're usually anxious or fearful and stuff, and they can tell, I mean, I think dogs can do this too, but they can smell the chemistry changes that happen in people's hormones. And what's interesting is that horses, in their own way and nonverbal ways, can mimic people. So I had one veteran describe a really powerful experience she had where she had like a pain in her leg that she had had since the military, which most likely was from her backpack or something that just wore and tore on her body. And so she had chronic pain in one leg. And she was put in an arena with a horse, and the horse, with no halter or anything, just the horse is what we call free lunging in there. And the horse willingly comes up to her and starts rubbing her leg, the one that's hurting, and starts lifting the same leg on himself. And what is that? And she felt that in her experience was that, oh my God, this horse is acknowledging and recognizing my pain. And she cried, and the horse just stood there and put his head in her chest, and she just cried because it was such a profound experience. There's so many experiences like that in equine psychotherapy where the horse in a way is mirroring the human experience. And it's difficult to quantify, and I think the scientific world that's really skeptical and logical, will explain that in different ways. But I think that's what makes the horse very special. The other part of it is that horses are outdoors usually, and then this is where the biophilia hypothesis and psychotherapy and NILU therapy come in, is that when you're outside, there is a natural, in a way, therapeutic effect that happens. And we know just by being out in nature, 15 to 20 minutes can be really restorative. And so I think that's just something that is given when you're with the horses and you're outside of the barn, kind of in a rural area, that is part of your entire experience as well. Yeah, and then there's something about people that like to do hard work. and when you're around horses, there's a lot of hard work. And so people, so many clients who want to come out and help muck stalls, clean the horses, help clean around the barn. And there's just something about that I don't know if it's people just want that back and they don't have it on a normal level. But that also, I think, is different too. And that there's that, just people come out, they like to be in their jeans and their cowboy hat and a lot more relaxed. And so that, but then, dogs can be great as well, but I think horses just have a different, and I think it's comparing apples and oranges to a certain degree. I'm definitely more biased towards the horse, but yeah, I hope that answered your question.
Yes, it did. And in fact, it gave me some ideas for the future. We're finding more and more that the dog, probably because it evolved so well with us, really can do things that no other wild animal can do, such as watching where you're looking and pointing. The truth is, the horse may have, which also grew with us, maybe there's an area of research that we're not giving enough credit to the horse. So that's for the future. That's when you're teaching a course. Okay.
Thank you.
Okay. But let me pass.
All right, so
great questions.
Glenn, Dr. Hartelius.
Hi, Rebecca.
Hi.
Yeah, it's been quite a journey for you here. Finding your way to this topic and then getting to focus it and then finding the right people and the long process of interviewing and analyzing. One of my questions is, where and when do you plan to submit an article that spins off some aspect of this dissertation?
I don't know. I don't know, to be honest. Part part of me is so resistant to doing any more writing or schoolwork for a very long time, just because it's been, I've been doing this for a while. But I don't know, honestly. I don't know what, I guess I would have to, I mean, as soon as possible, or just at least within the year would be cool. I guess I would have to figure out what parts of my research would, I could narrow down, and what a journal would want to see. I don't know that it's, I mean, maybe I'm being conservative, but I don't know if my research may be good enough for an article or for a journal, but I don't know what parts I would piece for that yet.
Mm-hmm. If you want to have a conversation about that sometime, be happy to do that. You know, something that you might consider, you know, you were talking about how the fact you had not seen in the literature any reference to the fear of the horse. You know, so a paper that, just a brief paper that focused in on an aspect that hasn't been discussed, and you know, maybe a little bit of a focused lit review that would kind of talk about you know, that issue if it shows up in other contexts, and then just kind of a more thorough presentation of what you found with these participants might be of interest to clinicians, since it isn't out there. And the other thing is, there's you know, a lot of qualitative work is done in dissertations but is never written up, and so doesn't really get to have the impact. So I mean, you know, when you were looking for this literature, how much like what you have done did you find?
In terms of my results? Yeah,
well, just in terms of like working with this particular population with EFP.
It was very rare. So I would say, I think my most lit review research I got, especially for veterans, like with my population with veterans or female veterans with EFP, was very rare at the time that I was looking. And I think I state that, I think it was like 2013 to 2016. Since 2016 to now, to 2019 or 20, there has been a lot more increase and a lot more interest, and studies are coming out a little more with veterans and horses.
Qualitative studies?
They're more like independent research.
Okay.
Like there's yeah, sorry, go ahead.
No, just saying, so they are qualitative, or?
I think they're trying to, so what's happening now in the horse world in research is they're trying to make it quantitative, and they're trying to have efficacy studies. So they're more mixed methods, efficacy, or excuse me, like they're trying to, the couple that I saw for the literature that I provided were trying to find like a treatment protocol. Like if a horse, if this is the treatment and they come for 5 sessions and this is exactly what the therapist does, what are the results? So there's a little more of that they're trying to do. And then, yeah, so they're trying to make more beyond a case study, if that makes sense. We know that there needs to be more quantitative research out there. So I think they're trying to go that way. But it's still very rare to see good EFP research with veterans.
So I really want to encourage you to take advantage of the fact that you're doing early research in an area that is just developing, to to write this up and put it into, submit it somewhere. And that it does take a very different kind of writing for a journal article. At JTS, if we get submissions, somebody's just sort of cut and pasted pieces from their dissertation and cut it down into article length. That really doesn't do it. I'm sure within a couple months you'll you'll miss it, the writing.
Oh God, no.
But, you know,
Yeah, no, I feel that. I totally feel that. I understand that. I know.
You know, I'm just encouraging because these women have shared their stories, and you spent a lot of time with this, and it you know, it deserves to be out there, so that other researchers can, you know, go through and go, oh, yeah, here's something that I can draw on in, you know, in their projects. So this is, like you said, there's still an area where there isn't very much, and it sounds like there isn't a great deal of the kind of work that you've done. So, you know, use that opportunity is my encouragement.
Thank you. I appreciate that.
Yeah. So, also wanted to know, so you have your license and you've had these experiences with the dissertation and on. How is the body of work that you have done going to inform your work going forward from here?
I started my own business. So I think to answer your question, it's like I've been waiting for this moment for so long and putting things off for so long. I've been feeling like held back, like a dam. And so if I were to pass and become a doctor, then it's like the floodgates open and here's Rebecca. So I feel like things, the universe works in perfect timing. And I just started my own business called Eudaimonia Connections, counseling services. And eudaimonia is Greek for the highest state of well-being. And I started at first for my private practice to do outpatient work. But my dream, of course, is to develop my own EFT program. And I'm tired of working for other people. Sorry, I want to design my own baby to a certain degree and my own equine program that includes not just standard mental health practices, but also the transpersonal part of it and bringing that in, I think is so important. And so I'm hoping by the end of the summer, you know, to be able to have that and be able to have that under Eudaimonia and be able to offer that to clients that they can do EFT work or outpatient work with me in the office or both. I've always wanted to be able to do both and or have that option. And yeah, I don't have any horses right now, so it's going to be interesting to have to find horse people and do like some kind of leasing and stuff until I can get my own couple horses. And eventually, of course, my own facility would be badass. But that's kind of where I see that going. And I feel like my whole goal for this was to be as thorough and kind of an expert to a certain degree in this field to help advance it. I really want to help EFT become more, I already feel like in a lot of ways there is evidence, but I think that EFT may never be able to demonstrate a gold standard just because there's so much complexity in it. But I want insurance companies to pay for it and for it to be considered a valid psychotherapy treatment option. Health insurance companies do recognize like occupational therapy, therapeutic riding. Dr. Beck is aware of this, where insurance companies have picked that up, and they tend to have really, really good research demonstrating that stuff. But mental health has always had issues being a soft science and all that stuff. So that's been my goal, is to kind of help that and kind of channel this momentum into that. And then, of course, at some point, start my journal, my journal of equines for mental health, which has been on the back burner over here. So,
right.
Yeah.
Okay. You said, and that's the term that's used, soft sciences. And it just struck me when you said it, from what you just said before, that, and a question, do you think it's that the science is soft, or might it be that the science tool is a little bit humbled in front of the complexity of living process?
Yeah.
Because we always want to, sort of blame the victim instead of going, well,
Mm-hmm.
so having done a dissertation like this, and which is of course very different. I mean, you have your clinical license and you're doing practice with people and you want to do work with horses. How do you feel that the intellectual process of doing a dissertation has impacted your role as a therapist?
I think to answer your question, I think it made me feel like I'm a little more of a trauma expert. Like I understand PTSD a lot more in that way, because to be able to hear someone talk about their PTSD that wasn't my client, you know, was very interesting to hear, and in a way was more like those oh shit moments, like, wow, this really affects this person for this long. And I don't know what, I mean, when I hear my clients with PTSD, you know, that's one thing, but to hear this and kind of like their stories in like a 40-minute synopsis, right, of the beginning to end and where they're at now was just so powerful. And so it made me, I think, more understanding as a researcher and a clinician at the same time. Post-traumatic stress disorder, trauma, how it affects someone, how it not just affects the mind but the soul, and how several of the women did talk about PTSD being a soul wound, and all of that stuff. So I think that helped in a lot of ways. I think also just from like a professional standpoint, I think me having this research background and then eventually being able to say Dr. Rebecca Wara-Goss, I think it makes me a lot more credible and have more of an expertise that clients may trust, and allows me to be able to channel my work, I feel like, in more literally qualitative ways, or, you know, just a little more well-rounded, if that makes sense. It kind of makes me a little more unique and have a niche compared to some of the other therapists in the field. And then horses are always interesting. Yeah, sorry, go ahead.
Oh, no. So what I hear is that the research stance and working with a few people, but from a different standpoint, and going deeply into their narratives you were able to gain a perspective that you would not necessarily have gotten from working with, 10 clients. Yes.
After their interviews, like after the recording, it was intense. It was very intense to hear their stories, and just from, beginning to end, their military experience stories were usually the worst ones to hear. And then the nicer ones to hear were, their connections with the horse, and they all remember their horses' names. They all felt like they were right there with their horse and stuff, which is so cool. But yeah, a lot of them were crying on the phone. I mean, it was, it's still very heavy with them. And because I had to be the observer and I couldn't help treat them, I think I just had to witness it too, was also different. Whereas if I was their therapist, be processing more and coming up with coping skill plans or whatever, that would be a little differently. Yeah.
So, and just this is the last question that I'll ask you, and that is, given the complexity of the ways that bodies and minds adapt to trauma, and how hard it is to put sort of firm boundaries on PTSD, and the many ways in which people heal, and all kinds of different variables in terms of the therapist that people were working with and their relationship to horses and so on and so forth. What gave you confidence that these people were actually getting better and they didn't just have a nice experience hanging out with a horse?
Yeah. So that's where I I think my semi-structured questions kind of helped narrow a little bit, some of that a little bit, because I asked, you know, did they have certain symptom relief? And so I was trying to, with my questions, direct them that way so that their responses might be a little more specific to if they did notice a change, what was it, if that makes sense. So whether like they're like, oh, I just.
Yeah, I'm also asking, what was most convincing for you?
Oh.
So there's the evidence piece. It's like, yeah, I'm going to ask and try to get these changes.
Yeah.
But what makes you come away from this, if that's true, come away from this going, yeah, these people got better and the EFP helped? What landed for you?
So sorry, like 5 things I want to say at once. The first thing that impacted me was that I think it was like 2 or 3 said that EFP was better and the best therapy they had compared to 10 years of treatment at the VA. And that they, and so that was powerful for me to hear, because I take for granted, you know, as a provider of it, that I assume it's going to work anyway, right? But to actually hear that, and to hear that it's more, that it was more effective than psychotropic medications for them. That for one client, or calling her a client, sorry, one participant, that it took her panic attacks away entirely. Like stuff like that is so incredible. And I think that's where it was great that, you know, the universe led it to lived experience, because you can hear that versus a survey response. So I would say hearing that was just so powerful. And I don't think I've ever really had that experience myself, as just being around horses. You know, I've never been a client EFP myself. I probably should do it at some point to have that experience. But I mean, I have been around horses just as a rider, or as the love of a horse, right? And they impact you. Like there's been many times that I've been terrified around a fucking horse because they look scary, or you fall off a horse, or they bite you, or, you know, there's the risk of getting killed around horses, and you feel that, but you still kind of overcome it. And it's very profound, I guess is the word to say. And so I think that for me it was relief to hear that they had any kind of relief at all, and that some really, really got better. The part that I wanted to report honestly, though, too, is that some did not get better. Some had short-term relief, like during the process they felt lower heart rate, or during the process they were able to have an experience with the horse, but it did not necessarily carry over into like a lasting impact. And a majority of them at the time of the interviews were still in some kind of treatment, whether it was still at the VA, which where most of them were getting the treatment. That's where most of them had heard about EFP, was through the VA resource centers. And so that was also really important to see too, that it's not all just Pollyanna, right? And that everyone's going to be healed and holla, right? But it's just, that was also important to include too. And then I guess with that, then, you know, there's the sorrow, and you hope that you could still help in some way to help them feel better.
Right. Okay. Well, that's, thank you. That's, I will hold questions there.
Thank you.
Okay, so Rebecca, I don't have that many questions, partly because a lot of questions I had thought of and written down are already, you know, you answered them, you addressed them. Like I was going to ask you about what your expectations were before talking to the participants when you wrote the, you know, proposal, but before you had any data. And then the outcome and what was surprising. You answered all of that as part of your, you know, presentation. I was going to ask you some questions, like the kinds of things that Glenn was asking you about, what we do with this, and so on. So I'm sort of out of any questions. There's one question that remains that I think would be nice for you to answer that. But let me also say something about. I don't know that much about EFP even now after reading, but I learned a lot from your dissertation, of course. And I remember I was walking in the Golden Gate Park, and it might have been in the car on the radio. I heard something about EFP for the first time. And, then I walked by some horses, and then probably a couple of months after that, I got to be on your committee. So something was preparing me for getting into all this. But just,
That's awesome.
from the fact that you're presenting this as a transpersonal experience or a transpersonal framework for this therapy, and the fact that an animal, to me, I don't know if it's my bias, but this is what I really believe in, is that what I'm sensing is that what seems to be working here is that there's another being there, there's another soul that is there, and that a lot can happen when that verbal component is taken out of psychotherapy. There are other nonverbal types of therapy as well. So there's just something about it. It might take a long time through a conversation to get to a certain point that you might bypass in a situation where there's no talking and there's feeling and sensing and intuiting and just working with another soul. So I would say, both a question and then basically a comment at the same time. I would say, I would really think more about the transpersonal aspect of this therapy, that you're writing about, and perhaps, an article that Glenn is talking about, maybe, can focus more on that. And just, to me, there's a lot of that in here, that maybe, is not being recognized. What is it that is really working here, and what makes this a healing practice? Perhaps other studies can be done that can actually be qualitative studies that go more into this kind of, let's see what actually worked, once you're past the basics. So anyway, I would say if you want to just take a minute or two and just say more about this transpersonal framework and how do you see this whole thing, and then I'll leave some time for the audience. We have 6 or 7 other people, so maybe there's a couple questions there, and then we'll wrap it up. But just go ahead. And so that's my only question. I'm very pleased with your presentation, and of course I know too much to ask you unnecessary questions here, and I don't think that I can ask a question that would be helpful to the audience, because there's a lot of detail there. So, so I think, we covered a good amount of that right now, but this transpersonal framework that you're talking about, can you say more about that, and what did you learn from that, from these encounters?
And do you mean the transpersonal framework in terms of my discussion of it afterwards, or before, like when I was doing the interconnectivity part of it?
Now at this point, now after all this, like what makes this potentially a transpersonal therapeutic process or an adjunct to some other kind of therapy? What is the transpersonal part of it? What is transpersonal about it?
Perfect, thank you. So I think that the transpersonal part of it is an element of the human-animal bond. And transpersonal means, as Dr. Hartelius helped define, is transcendence of the self. And very often, what I was trying to pull in, because the human-animal bond is about connecting human and animal, is interconnectivity, which is also a part of transpersonal, and that interconnectivity is a connection with self and everything else. And I think that it's kind of like a macro concept that's felt in like a microcosmic way, I guess, and that you feel it inside, even though you can recognize that we are connected to a certain degree, but you have to feel it. And that's what the human-animal bond is it's a feeling, it's a connection. How we describe that, I think, is so hard sometimes. And I think transpersonal psychology framework really gives the language to describe it. And this is where I write about, about bringing in transpersonal psychology and this transpersonal world into my research, and how important it is to continue and advocate for other researchers to do this as well, is to bring this in, is that transpersonal holds space for the spirit. And the spirit can be anything. It can be, your sense of self. It can be connection to other, God, universe. Mother Mary, whatever it is. It's just that resonance that you feel that makes you so unique and different than any other person to a certain degree. And that's the part that, as a transpersonal practitioner, I want to help heal and help other people transcend and move through. Healing is a retroactive forward process, right? You heal from the past through the present to heal to the future. And I think transpersonal psychology just has all of it, has all the juice to make it work. But it was arguably very, very difficult in the transpersonal world to find, some way to connect it. So I really had to, because I wanted to find interconnectivity itself. So it took me a cool minute to find that and kind of like really parcel it and pull it in so that it would make sense. Because then I also had to kind of pull in, the Gaia hypothesis and then this and this and this to try to make it all make sense, which made sense to me, but how to make it evidence-based or how to make it back to resources, right? So people understood it. And so I think that the human-animal bond in connection to the horses is that horses are, like, when we look at a horse, at least when I look at a horse, they're so beautiful. They're so magnificent. And it's just, I don't know, maybe I have that horse effect, but every time I look at a horse, I go, ooh, horsey. Like, I don't know what it is. There's something about them. And I think animals in general, like when you see a deer, it has an awe effect. I think horses have that too, versus maybe a cow. But horses just kind of have that effect where they're just like, wow, they're beautiful. And they've been intertwined in mythology and very often, I think, in a way, have become a spirit ally and being able to want to willingly participate with humans. Like once they're connected and trained, they want to work, they want to please, they're very much like a dog, that wants to have that connection with you. And so I think, yeah, so I can keep going on and on, but I think I hopefully answered your question.
Yeah, I'm glad that there's a good deal of what they said, in the transcripts, at least the pieces that you shared with me. I could see that there's something like that going on, that you didn't ask for people to participate in case they had spiritual experiences, but there seems to be an indication that everybody is, most of these people were kind of pointing to something of that nature. So, great. I think that I will just stop here in terms of, I'll just give you all the support in the world in terms of your future success. And you did a good job. Let's see if the audience has any questions. We still have a half an hour before we have to end the meeting. So I wonder if it's possible, Stefan, to unmute everybody so they can actually, we have a captive audience with duct tape on their faces right now, so maybe they can actually speak. You don't need to type up the question, but if anybody wants to say hello or ask a question, that would be great.
All right. It's taking more doing than I thought. Okay, give me just a moment. I can do it individually.
I just cleared the memory of it, so it's good to go.
Wow.
We still have control of our own, Stefan.
Oh, okay.
This is Jeff.
Great. Then just unmute yourselves if you have a question.
Hi, Rebecca. I'm Jeff Henson. I'm a PhD student here at CIIS in the EWP program. And I have a couple of questions. The first one is, how did you, or maybe you didn't, account for any bias that there may be in your work as it pertains? Wait a minute, I need to ask a question first. Are you a veteran or a first responder?
No, I'm a civilian.
Copy. So what did you, or how did you account for any bias that the feedback that you may be getting from the participants as it pertains to you not being part of their tribe?
Okay.
Yeah, so and when you say part of their tribe, do you mean that because they were military service women?
Correct.
Okay, gotcha. Yeah, so no, I mean, I came from the place of being a civilian, and I was very clear with my participants. Oh, is there background noise?
Yeah, somebody has a lot of background noise. I wonder if you could turn off your mic.
I think that was me, Bob, and I'm sorry. I've turned it off.
Oh, okay. It went away. Thank you. Perfect. So to answer your question, Jeff, the first thing I will say is that I did let my participants know that I was coming from a place as a civilian, that I didn't have any personal experience in the military, and I couldn't possibly quite understand what their experiences were because of that. And I mean, I have family members that were in the military, but I've never been in the military myself. And so I was clear about that, you know, I am a tabula rasa, so to speak, that I'm here as a witness, so please share your experiences, and I will do my best to try to be as objective as possible. The ways that I tried to be objective in terms of the information were a couple of checks and balances that we would put into qualitative research, which I do mention in my methods part. And one of that was that I did hire a transcriber who filled out a confidentiality agreement to, you know, transcribe all that stuff and be able to capture that. And then I did at one point also hire a data analyzer to help start the process of data analyzing first. So it's kind of like having 4 different eyes or 2 sets of eyes on that, so that the data that I was receiving was more from an objective standpoint, if that makes sense. And then
sure
also,
does.
yeah, and then also Dr. Bauman and Dr. Hartelius also helped with objectivity in terms of just really making sure that my data analysis was, which I had to redo twice. So the results of the 3rd attempt, you know, were very clear and were done in a more rigorous way, if that makes sense. And then it's actually better that it happened that way, because then the results that came through were a lot more clearer and definitely made more sense in terms of the themes that were coming forward. Yeah, and I mean, I think that although I have the background that I do, I think it just, in a way, just helped me understand the experience and the process better, but it didn't, I don't feel that it made me influence the results in any way other than just describing it. I think it just, if that makes sense, like it kind of just, in a way, maybe enhanced it. But, you know, I think in my discussion, I do talk about my researcher bias and the background that I do come from. And so, like, with the results that came through, I was really happy to see that there was stuff there that I was hoping was there, but that I didn't force out or, you know, manipulate in any way.
Gotcha. Thank you very much, and I very much look forward to reading it. I will be maybe the 4th person who will read it cover to cover.
Thank you. And did you serve in the military?
I did 14 years.
Thank you for your service.
You're worth it, Rebecca. The second question I have is, did you take into consideration adverse childhood experiences as part of your research as it pertains to the depth of the PTS?
Great question. No, I didn't ask specifically about prior experiences. Well, I mean, in terms of childhood, what I did ask was what was their experiences like before, or I was like, what would you like to share about your experience before the military? And what was your experience like in the military? So it's kind of like an overarching thing of very open-ended first question of, you know, what would you like to share about your experiences either before the military or while you're in the military, basically. My main, like, in terms of like the focus of the semi-structured interview was try to capture the military experience. But some of the women did share a little bit about their experiences, especially when it came to horses, because I had a question in there about did they have experiences with horses prior to their EFT treatment, and most of them hadn't, but some had, and so they would talk about their childhood experience when they first met a horse, kind of thing, but they did not. None of them actually really talked about traumatic experiences before or said that they had PTSD before. Most of them talked about their PTSD being developed after, right? And then kind of they knew that they were, because in order to participate in my study, they had to have a PTSD diagnosis verified. So they, and all of them essentially stated either blatantly, like verbally, or definitely indicated that their PTSD they got was while they were in the military. But they could have had childhood trauma before that, and they could have, been set up to be have more of a higher prevalence rate to developing it. That I don't know, but I did not ask about early childhood traumas.
Copy. Thank you. And again, I will read it. It's very, you're hitting me right in the stomach here with this, because it's profound. My parting comment here for you is, if you should choose, we run, the organization where I volunteer is called Save a Warrior, not Wounded Warrior, but saveawarrior.org. And we run a 4.5-day intensive retreat in Southern California. We do 5 a year for female veterans alone. So if you happen to be doing more research, maybe it's something you want to come and sit in the seat or observe to. I'll offer that to you. You can reach me at jeff@saveawarrior.org. I'm a volunteer there, and I'd be willing to take a look at how we can help your research.
Wonderful. Thank you very much. I wrote down your information, Jeff, and I would love to stay connected with you. Yeah, thank you very much. And if you have any feedback or questions after you read my very long dissertation, please feel free to reach out to me via email if you'd like.
Copy. Thank you. And
Rebecca, you might
yeah.
want to type in your email in the comment section for anyone who wants to contact you. We don't have a lot of time right now. I just want to make sure that if there's anybody else that wants to speak, we have about 5 minutes left.
Okay, yeah, I just posted my email address in the chat. Please feel free to email me. We can stay connected.
Great.
Thank you.
Any other questions from the audience? Yes, go ahead, Kobe. Turn on your mic.
Hi, thank you. Hi, Rebecca. It's we've been following each other a bit on Facebook, and being fellow Sophia refugees. It's
yes.
I'm happy to see.
We went on our boats across the bay. Thanks to Glenn. Glenn was our savior.
He was.
Thank you, Glenn, for that.
So I'm happy to just witness this this event, and there's a lot, but I'll keep my questions, a couple of questions down. One is just more of a personal, relating to horses. I have a daughter who rides English, and I'm wondering, is there certain types of horses that you would use in terms of breeds or things like that? That's one.
Yeah, that's a good question. Arguably, in horse therapy, any horse can be used. What comes up though has to do with safety, right? So what's interesting is, like, you could have horses that are maybe, say for example, you get Mustangs, right? And they get off the rangeland and they're put in the corral and they're not trained yet. So, right, you don't want the client handling them, but you could still do EFP with having them observe the herd, and talk about them. And so sometimes some of the more animated horses that, buck and play in the corral, not on you, can be really cool experiences in EFP compared to the more placid old one that just stands there and doesn't do anything. So arguably any horse can be used. But if you're wanting clients to handle them, I come from the path of international safety first, is that you want to have a horse that's relatively well trained, that's not going to bite, doesn't have a history of kicking, and any size, honestly. Sometimes the miniature horses have been the best and the coolest to work with. They won't obviously be able to ride the horses, but they're less intimidating. And it's a really nice way to have them connect with an equine, even though it's little. So those have been fine. But if you want them to ride the horse, then you want to have a horse that's a lot more well-trained. a lot more older. That's not going to spook more readily. So for some of the riding horses in EFP, I would definitely say the older ones that are a little more arthritic are probably more ideal than the younger ones that might be a little more frisky and spook if they see it back floating around in the wind. So, yeah.
Great. Okay. My other question relates more to the research aspect, and it ties in with a previous question. In terms of the connection with the horse, did you, because I haven't read your dissertation, but did you account yet? How did you account for any kind of projective identification onto the horse, if that makes sense? Or where someone, I don't know, I'm trying to get my words right. But yeah, just maybe anthropomorphizing their experience of the horse, things like that. How would you tease that out if you did?
So I didn't tease that out, but I did include it because there were several times that clients would, or not, I keep calling clients, but participants would relate to the horse in like a very personal way, and say that horse understood my trauma because he had trauma too. Or that horse understands my anxiety because I have anxiety too. So that was such rich information, and was okay to come out in this kind of a research. I want to hear all of that. I want to hear what their experience was like and how they felt they identified with the horse or not. And so there was a lot of self-identification that was in there. And I have that, I think, in my results where it didn't come in as like a big, like more than 5 participants. I didn't include it in the abstract. But there were the perceptions of friendship, perceptions of protective behavior from the horse. Where the horse was like protecting them from another horse was the feeling. So there's a section literally on self-identification with the horse. So it absolutely came through. And in EFT work, projective identification is encouraged. And that's where it kind of gets a little gestalt, where the classic treatment in gestalt, you have a couch and you pretend it's your ma and you yell at it, right? Kind of thing. It's just kind of something that's outside of yourself, but it's part of the internal treatment thing, I guess. So there is a lot of that's put on there. And research, I mean, that's where the difference between like quantitative survey versus qualitative, really getting that information was really helpful actually to see.
Okay, thank you so much. Kobe, I know you may have more questions, but both you and others, if you'd like to contact Rebecca, do some follow-ups with her, that would be great. We're just running out of time. We need to do some committee business here. And so I would say this concludes the sort of public portion of our meeting, and I would say thank you to everyone who took time to be here today. I will meet with the committee for about 5 minutes or so, so everybody else is going to be turned off. We appreciate it if you log out, and then Rebecca, I'll do a quick text to you when we're ready so you can come back in, and then we'll just give you the final thought on your presentation.
So, okay.
So Rebecca, I think that we can very positively say that you did a great job in just presenting your work and answering the questions. And of course, the work to be done from now is just to wrap up the dissertation. So congratulations, you passed the oral, and you can take that C off of the PhD candidate now. That's the question that you had. So we will call you Dr. Rebecca from now on.